If you've been trying to get pregnant for months or maybe even years, this could change everything for you. The journey to building a family can be so full of questions, so much confusion, especially when you start looking at medical treatments. So today, we're going to break down three of the most important and honestly most confusing acronyms in the world of fertility: IUI, IVF, and ICSI. The whole goal here is to make these options super clear so you can feel confident and empowered when you're talking about your journey. We're going to look at what each one is, exactly how it works, and who it's really designed to help. All right, first up is IUI, which stands for intrauterine insemination. For a lot of people, this is the first step they'll take with a fertility specialist. You can think of it as a simpler, much less invasive place to begin. So what is it really? Well, IUI is a procedure that's all about giving sperm a major head start. See, instead of having to make that long, difficult journey all the way through the cervix, the sperm is specially prepared and placed directly into the uterus right when ovulation is happening. This gets it so much closer to the finish line, which are the fallopian tubes, where all the magic of fertilization happens. The process itself is actually pretty straightforward. First, a sperm sample is given. Then it goes through something called a sperm wash. Now, it's not really about cleaning them. It's about separating the strongest, fastest swimming sperm from all the other fluid. So you end up with this concentrated sample of just the best swimmers. That sample is then gently placed into the uterus with a tiny flexible tube. And from that point on, it's up to nature. Okay, now this number is a really, really big deal. This comes from a huge study. We're talking over 92,000 cycles that found a critical number for success. What it tells us is that for the best possible chance of IUI working, you really want at least 9 million of those supermodal prepared sperms starting the race. Think of it like making sure you have enough runners on the field to guarantee one makes it to the end zone. Anything more than 9 million didn't really boost the odds, but dipping below that number, that's where success rates really started to drop. And that brings us to success rates. In general, IUI has a success rate of about 10 to 20% per cycle. But, this number can change a lot depending on things like a woman's age, the specific reason for infertility, and whether fertility meds are being used to help stimulate the ovaries. It's a real boost for sure, but it often takes a few tries. So let's just lay out the pros and cons. The biggest advantage of IUI, hands down, is that it's way less expensive and a much simpler process than something like IVF. The trade-off, though, is that lower success rate and having a lot less control. Once the sperm is in there, everything is up to nature, and there's just no way to know for sure if fertilization or implantation actually happened. So, if IUI is the starting point, what happens when it's not the right choice? Or maybe when a few tries just haven't worked? Well, that brings us to our next step up, IVF. And you can really think of this one as the powerful upgrade in fertility treatment. IVF stands for in vitro fertilization, and that in vitro part literally means in glass, which points to the single biggest difference. Fertilization happens outside of the body, in a lab. And this gives doctors and scientists a huge amount of control over the whole process. Now, the IVF process is definitely more involved. It all starts with injectable medications that stimulate the ovaries so they produce multiple eggs at once, not just the single egg you'd get in a normal cycle. Then, those mature eggs are retrieved in a minor procedure. After that, in the lab, the eggs are combined with sperm to create embryos, and those embryos are watched very closely as they grow for a few days. Finally, the best-looking, healthiest embryo is carefully chosen and transferred into the uterus. And you can see the difference in the results right here. It's pretty dramatic. Because IVF gives the medical team control over so many more of the variables. They can actually see that fertilization happened and they can choose the best embryo to transfer. The success rates are just so much higher. We're talking up to 60 or even 70% per cycle in some cases, which is just a massive leap from IUI. And the benefits go way beyond just higher success rates. IVF offers some really unique solutions. For example, it was literally invented to get around the problem of blocked fallopian tubes. It also allows for something called pre-implantation genetic testing, or PGT, which screens embryos for genetic issues before they're transferred. And, this is a big one, any extra healthy embryos can be frozen. This is such a powerful way to preserve your options for having more children down the road. But what if the problem isn't getting the sperm close enough to the egg? What if the sperm itself is having trouble actually fertilizing the egg? Well, this is where a super specialized technique that's used alongside IVF comes in. It's called ICSI, and it's basically a precision tool. ICSI stands for intracytoplasmic sperm injection. It's a mouthful, I know. But what it is a microscopic procedure where a highly trained embryologist picks out a single, healthy-looking sperm and, using a teeny tiny needle, injects it right into the center of the egg. It completely removes any guesswork from the fertilization part of the equation. So, when do you need this incredible level of precision? ISSI is an absolute game changer for what's called severe male factor infertility. That means cases where there's a very low sperm count, or the sperm don't swim well, or maybe they have an unusual shape. It's also absolutely essential if sperm had to be retrieved surgically, right from the testicles, because those sperm usually can't fertilize an egg on their own.
Okay, so we've gone over the what and the how for all of these treatments. Now for what is probably the most important part, which one is for me? Let's walk through a little guide together to help make those key decision points a bit clearer.
The very first question is a big one, and it's a structural one. Have you had a test, it's called an HSG, to find out if your fallopian tubes are open and clear? If the answer is yes, your tubes are blocked, then the decision is pretty much made for you. IUI just can't work in that situation because the sperm and the egg have no physical way to meet. IVF becomes the clear, definitive solution because it bypasses the tubes altogether. All right, the next critical question we have to ask is all about the sperm analysis. Are we dealing with a very, very low sperm count, or are there other serious issues with the sperm's health? And if that's the case, then IVF with ICSI is absolutely the recommended tool. Think about it. When you only need one single healthy sperm for each egg you have, it can overcome even the most significant male factor challenges.
So this little table here helps pull it all together for some other common situations, for something like unexplained infertility or a mild male factor issue. Starting with a few cycles of IUI is a very common first step. But if you're over 38 or your goal is to have more than one child, going straight to IVF might actually be the more efficient path to building your family, since you can freeze extra embryos. And of course, budget is a very real thing for everyone, which often makes IUI the most logical starting point to consider.
Now, please remember, this is so important. This guide is meant to help you feel informed and prepared, but it is absolutely not a substitute for real, personalized medical advice. The single most important step you can take is having a detailed conversation with a fertility specialist who can look at your unique situation and help you make the best choice. Because at the end of the day, your path is totally unique to you. The science and the data give us these incredible tools, but the right choice is always, always the one you make with your medical team, feeling empowered, feeling informed, and most of all, feeling hopeful about the road ahead.